In this video, we're going to talk about the circulatory pathways, blood pressure, and the resistance to blood flow. There are several types of circulatory pathways. The first one is called the simplest pathway. There is only one capillary bed exchange blood between veins and arteries. This type of simplest pathway, the blood will leave the heart, goes to the arteries, then arterioles, then capillaries, venules, back to the veins, then back to the heart. The second type of the circulatory pathway is called portal system. In this type of circulatory pathway, there are two capillary beds for blood exchange. Portal system can be found in kidneys. It can also be found between the blood circulation from intestine to liver. It can also be found between hypothalamus and anterior pituitary gland in the brain. The third type of the circulatory pathway is called anastomas. There are two types of anastomas. One is called venous anastomas. The other one is called artery anastomas. Combination of both of them are called arterial venous anastomas. In this type of blood circulation, there's only one capillary bed. The other route is a direct blood exchange between arteriole and venule. There is no capillary bed here. This pathway is called a shunt. Venous anastomas is relatively simple compared to arterial anastomas. The arterial anastomas, there are more arteries the blood can bypass through the capillary bed. In venous, there's only one vein. You can go back to the heart. This type of blood circulatory pathway can be found around the joint area, and it is very common for coronary circulation in the body. The next concept is blood pressure. Blood pressure is the force that blood exerts against the vessel wall. It can be measured at brachial artery of the arm using a sphygmometer. Two pressures are recorded when blood pressure is being measured. One is called a systolic pressure. It's a peak artery blood pressure taken during ventricle contractions. The other blood pressure is diastolic pressure. It's a minimum arterial blood pressure taken during ventricular relaxation between heartbeats. For a young adult, the blood pressure is 120 millimeter for systolic pressure and 75 for diastolic pressure. Pulse pressure is the difference between systolic and diastolic pressure. It is an important measurement of driving force on circulation and of stress exerted on small arteries by pressure surges generated by the heart. Another measurement for blood pressure is called mean arterial pressure. This is the mean pressure one would obtain by taking measurements at several intervals throughout the cardiac cycle. It is the diastolic pressure plus 1/3 of pulse pressure. The average blood pressure that most influences risk level for fasting, atherosclerosis, kidney failure, and aneurysm. Since blood pressure varies across the cardiac cycle, blood flow in artery is pulsatile. The speed of blood flow can change from 40 centimeters per second to 100 centimeters per second. In capillaries and veins, blood flows at a steady speed. Blood pressure tends to rise with age. When people get older, there's a higher risk for blood pressure to increase, and there's also a high risk for atherosclerosis. Hypertension is a high blood pressure. The blood pressure level will be above 140/90. Hypotension is a chronic low resting blood pressure, which can be caused by blood loss, dehydration, or anemia. Blood pressure changes can be determined by cardiac output, blood volume, and the resistance to flow. The blood volume is regulated mainly by kidneys. Blood pressure changes with the distance of blood from the heart. When the blood is close to the heart, For example, aorta, it has the highest blood pressure. When the blood is away from the heart, the blood pressure will decrease with the distance from the left ventricle. The resistance to blood flow is called peripheral resistance. Resistance are affected by three variables: blood viscosity, vessel length, and vessel radius. Blood viscosity is also called blood thickness. The content of red blood cell and protein concentrations such as albumin will increase viscosity the most. Decreased viscosity can be found when people have anemia or hypoproteinemia. Increased viscosity can be found with polycythemia and dehydration. The farther liquid travels through a blood vessel, the more accumulative friction it encounters. The increased resistance can be observed when the blood vessel is longer. The vessel radius is the most powerful influence over flow. The larger the radius is, the lower the resistance is. The smaller the radius is, the more resistance can be found. For example, from aorta to capillaries, blood velocity will decrease for three reasons. Greater the distance, the more friction to reduce the speed. Smaller the radius is, the more resistance can be found. Farther away from heart, the number of vessels and their total cross-section area become greater and greater. However, from capillaries to vena cava, velocity will increase again. Arteries are most significant point of control over peripheral resistance and flow. On proximal side of capillary beds, and best positioned to regular flow into capillaries. Other type of artery providing the most numerous control points. More muscular in proportion to their diameter, they are highly capable of changing radius. Arterioles produce half of the total peripheral resistance. There are three ways to regulate blood pressure and blood flow: local control, neural control, and hormonal control. Local control include autoregulation, which is the ability of tissues to regulate their own blood supply. If tissue is inadequately perfused, wastes accumulate, stimulating vasodilation, which increases perfusion. Bloodstream will deliver oxygen and removes metabolites. When wastes are removed, blood vessels are constricted again. Substances called vasoactive chemicals are secreted by platelets and endothelial cells to stimulate vasomotor responses. For example, histamine, bradykinin, and prostaglandin can stimulate vasodilation. When vasodilation increases, the exchange between blood and tissue waste will be more efficient. Endothelial cells can secrete prostacyclin and nitric oxide. Both of them are vasodilators. The central and autonomic nerve systems can control blood vessel sizes. The sympathetic nerve system will stimulate most vessels to constrict, but dilate vessels in cardiac muscle to meet demands of exercise. Vasomotor center located at the medulla oblongata of the brain is the integrating center for three autonomic reflexes. These three reflexes are baroreflexes, chemoreflexes, and medullary ischemic reflexes. Baroreflexes can provide negative feedback to any change in blood pressure. Increases in blood pressure can be detected by carotid sinuses. Then this change will be sent by glossopharyngeal nerve to brainstem, result in first inhibition of sympathetic, cardiac, and vasomotor neurons activity. Second, excitation of vagus nerve that slow heart rate and thus reduce the blood pressure. If the blood pressure decreases, then the opposite effect above will occur. Baroreflexes govern short-term regulation of blood pressure. It adjusts the rapid change in posture This type of reflex is not very helpful in correcting chronic hypertension. Chemoreflex is an automatic response to change the blood chemistry, especially pH and the concentrations of oxygen and the carbon dioxide. Chemoreceptors are called aortic bodies and the carotid bodies. They are located in aortic arc, subclavian arteries, and external carotid arteries. The primary role of neurocontrol is to adjust respiration to change the blood chemistry. The second role is to change vessel motion to regulate the blood flow and the breathing rhythm. The third type of neurocontrol is called medullary ischemic reflex. It's automatic response to a drop in perfusion of the brain. This type of regulation is mainly regulated by medulla oblongata. When ischemia is sensed, the reflex is being activated. The cardiac and the vasomotor centers will send the sympathetic nerve signal to heart and blood vessels to increase the heart rate, and the contraction force causes the widespread vasocontraction through the body and raise the blood pressure to restore the normal perfusion to the brain. Other brain centers can also affect the vasomotor center, such as stress, anger, arousal. The third type of control for blood pressure is hormonal control. Hormones influence the blood pressure, some through their vasoactive effects, but others through the regulating of water balance. Angiotensin II is a potent vasoconstrictor. It raises the blood pressure, promotes sodium ion and water retention in kidney, and increase blood volume and pressure. Arterial natriuretic peptide also increases urinary sodium excretion to reduce blood volume and promotes vasodilation to lower blood pressure. ADH promotes water retention and raises blood pressure. Epinephrine and non-epinephrine affect most blood vessels. They bind to different receptors to have end results for either vasoconstriction or vasodilation. There are two purposes for these three types of vasoreflexes. One is to control blood pressure. The other one is to routing blood from one blood region to another. These two types of purpose are very important to regulate blood pressure, to maintain the correct perfusion in the brain, as well as the needed for organs during exercise and disease conditions. For example, at rest areas, blood circulation is distributed proportional to needed activities. However, while people doing moderate exercise, large amount of blood flow will be required to be delivered to the muscular tissues. Capillary exchange during the blood flow is the most important steps to deliver oxygen, water, and nutrients. Capillary exchange is a two-way movement of fluid across capillary walls. These materials pass through the capillary wall by three routes. One is through the endothelial cell cytoplasma. The second one is through the intracellular clefts between the endothelial cells. The third one is through the filtration pores of the fenestrated capillaries. The mechanisms for capillary exchange include diffusion, transcytosis, filtration, and reabsorption. Insufficient exchange between capillaries and tissues can cause edema. Edema is defined as accumulation of excess fluid in a tissue. It occurs when fluid filters into a tissue faster than it is being absorbed. There are three primary causes for tissue edema. One is to increase capillary filtration because of the kidney failure, histamine release, aging, and poor venous return. Another reason is due to reduced capillary absorptions results from the hypoproteinemia, liver problems, or dietary protein deficiency. The third cause can be due to obstructed or damaged lymphatic drainage. The surgical removal of lymph nodes could be the reason for tissue edema. The results of the edema can lead to tissue necrosis, pulmonary edema, cerebral edema, or circulatory shock. In addition to the efficiency of capillary exchange with the tissue, venous return is another important step for blood to circulate back to the heart and maintain the regular blood pressure and blood flow. Venous return is the flow of blood back to the heart. It relies on pressure gradient, gravity, skeletal muscle pump, thoracic pump, and cardiac suction. Blood pressure is the most important force in venous return. The normal venous pressure toward the heart is between 7 to 13 mm Hg. Venous to central nervous system pressure will be 12 to 12 mm Hg. The point where the vena cava enters the heart is about 5 mm Hg. Gravity can drain blood from head to neck. Skeletal muscle pump in the limb can squeeze blood out of the muscle to the veins to help with the venous return. During the inhalation, thoracic cavity expands and the thoracic pressure decreases. Abdominal pressure increases and force the blood go back to the heart. This figure shows how skeletal muscle pump works. During the muscle contraction, the blood will be squeezed back to the veins, go back to the heart. During the relaxation, the valve open from the venous, the blood will flow back to the muscle. Exercise can increase venous return in many ways. During exercise, the increased blood pressure and the blood circulation can be found because the heart will beat faster and harder. The vessels of skeletal muscles, lungs, and the heart will dilate and increase the blood flow. The respiratory rate will increase, and the thoracic pump will increase too to increase the blood flow. The skeletal muscle pump will increase its activity to increase the blood flow. Venous pooling will occur during inactivity. Venous pressure will not be enough to force the blood going back to the heart. With prolonged standing, blood pressure may be low enough to cause dizziness because the inactivity can prevent by tensing leg muscles, activate skeletal muscle pump. The circulatory shock can occur due to insufficient blood flow to body's metabolic need. Cardiogenic shock is defined as inadequate pumping of the heart. Low venous return is defined as cardiac output is low because too little blood is returning to the heart. Three principal forms of low venous return shock. Hypovolemic shock, which is most common. This is the loss of blood volume due to trauma, burns, and dehydration. Obstructed venous return shock. This is due to tumor and aneurysm compresses the vein. Venous pooling shock. This is due to long periods of standing, sitting, or widespread vasodilation. Neurogenic shock. This is due to vasomotor tone vasodilation. It can be caused from emotional shock to brainstem injury. Septic shock. This is due to bacterial toxins trigger vasodilation and increased capillary permeability. Anaphylactic shock. This is due to severe immune reaction to antigen histamine release, generalized vasodilation, and increased capillary permeability. The responses to circulatory shock. One is the homeostatic regulation to compensate the shock. There are several mechanisms can bring about the spontaneous recovery. For example, if a person faints and falls to a horizontal position, gravity can restore blood flow to the brain. When compensation fails, life-threatening positive feedback loops occurs. Condition can get worse which can cause damage to cardiac and brain tissues. Therefore, the circulatory shock is a very severe situation for people, and it needs attention. In summary, this video is about blood flow, blood pressure, venous return, and circulatory shock.